All right, it's time to get your medical questions answered live.
We're taking your calls today for Dr. Zorba Paster. The number is 270-9933. Welcome back, Zorba. Let's go to our first caller, Mary in Madison. Hi, Mary. What's your question?
Yes, hi. I haven't seen it in the news or anything, but it seems to me that covering your eyes with your either glasses or goggles would be helpful against the, getting the virus. And also, even though wearing a mask plus breathing through your nose specifically versus your mouth seems to be, in my mind, helpful to not get a virus.
Well, I don't think breathing through your nose versus your mouth is actually going to make much of a difference, because it turns out the virus can enter either through your nose, your mouth, or through your eyes. If you're in a situation where you're for instance, you're a healthcare provider, of course you're going to wear a shield because it can go through into your eyes, into your nose. The real issue with the mask are it keeps other people from actually getting it if you actually have COVID and don't realize you have COVID. That's the real benefit of wearing the mask. But also, I think wearing a mask reminds you not to touch your face, reminds you to social distance, and sort of to be a good neighbor. And I look at wearing a mask the same as washing your hands after you're in the bathroom. It's a good thing. Your mother would say to do it. Wearing a mask is the right way to go.
And if you're wearing glasses, too, that keeps you from touching your eyes.
Yeah, exactly.
All right, let's go to Lisa from Madison. Hi, Lisa.
Hi.
What's your question?
My question is that back in January, I was traveling overseas. Ironically, I was in India, just as you were talking about the locust in India. And when I came back, I had a severe bout of pneumonia with some loss of hearing, and I was put on steroids. And, of course, currently also I'm having a lot of allergies, and they've tested me twice for COVID with a negative result. But what I'm curious about is, could I have possibly had COVID after my international trip back in January? And does it help to have the antibody testing? In any way, does that, help me to not get it, or I'm not sure?
Oh, sure. Well, let me answer the second question first. We don't know if having antibodies will protect you from having COVID in the future. And we also don't know how long it will protect you, even if it does protect you. That's the million-dollar question. We don't have the answer yet. If you've had 2 negative COVID tests, chances that you had COVID are pretty minimal. They're not zero, because there's a false negative rate and a false positive rate, but pretty unlikely you had COVID. There are lots of other things that can give you pneumonia, and you probably had it from something else. Influenza can produce pneumonia, and a variety of bacteria. It's still number 1, somewhere in the top 10 leading causes of death. So there are lots of things that cause pneumonia. I doubt if it was COVID.
All right, let's go to Shirley in Madison. Hi, Shirley. What's your question?
I would like to know how much carbon dioxide would one inhale by wearing a mask?
Not much. You do inhale a little bit of your carbon dioxide, but not much. Now, if you've got chronic lung disease and you're on oxygen, you're not going to be able to tolerate a mask. And the fact is, you should not really go out of the house unless you absolutely have to. But for most of us, the minimal amount of carbon dioxide that you're inhaling is not going to make a difference in your life. Okay. It's safe.
All right, let's go to Sue in Madison. Hi, Sue. Sue, you there?
Yes, I'm here.
Go ahead. What's your question?
So I did not have any symptoms whatsoever. I work in the healthcare environment, and I guess I consider myself kind of an anomaly because I did take the antibody test, and my results were positive.
Mm-hmm.
Interesting.
Well, I don't think you're an anomaly. I think a number of people in healthcare are going to turn positive and not have any symptoms, because most people don't have symptoms, and that's the whole problem. If you came down with a rash, like in measles or chickenpox, then we would know who had COVID and who didn't. But most of us are asymptomatic who have COVID. I don't have COVID. Maybe I did. Maybe I'll find out. I was in New Orleans just before everything struck. I haven't gotten an antibody test, but maybe I had COVID. We're going to find out once we have good, accurate, easy testing that there was more COVID around than we ever thought. The problem is a certain percentage of the people get COVID, and some of those get really sick, and of course, a number of them die, 1 or 2%.
All right, let's go to Charlie in Richland Center. Hi, Charlie. Charlie, you there? Charlie is not there. He was going to ask, we were told to stay in, now we're told to go out. I'm not sure anybody said to go out.
No, I don't think anyone said you should go out. I think self-quarantining is really still the answer. If you want to go out, I think you should still limit your activities when you go out, because the fact is there still is a lot of COVID around. Social distancing is the most important thing we can do. Masks really do not protect us. Staying 6 feet away from other people really will protect you from getting COVID. You're less likely to get COVID outside than inside, but you can get it outside too. Believe me, it's no protection at all. So quarantine indoors unless there's a reason to go outside.
All right, let's go to Deb from Randolph. Hi, Deb.
Hi, how you doing? My question is, if you have the flu vaccine, can you have a false positive result?
No, the flu vaccine will not give you a false positive result for COVID. Very different test, not the same test at all.
All right, we're out of time. Thank you all for calling in. We'll do this again next week. People still have a lot of questions.
Yeah, they do. So Zorba, we really appreciate your time doing this with us every week. It's very helpful for everybody. Thank you so much.
Thank you.
Stay well.
You too.
We'll have a final check of your forecast coming up.